This video is on parotid duct, and in this I'll consider the origin and course of parotid duct, the structures that are pierced by the parotid duct and its surface marking. In this picture we can see here this is the parotid gland and this is the parotid duct. The parotid duct is also known as Stenson's duct. It is a tubular structure which is thick walled and is approximately 5 centimeter long and 3 millimeter wide. Let us look at the course of the parotid duct. So this parotid duct, this will be formed within the gland by joining of smaller ducts, and it emerges on the face at the middle of the anterior border of the parotid gland on the surface of this muscle, that is masseter muscle, a finger breadth below the zygomatic arch. After that, we can see here this is going to run forward and slightly downward on the masseter muscle, that means superficial to the masseter muscle and inferior to the zygomatic arch. We can see here the parotid duct is placed between the two branches of the facial nerve, the upper buccal and the lower buccal branches. In this horizontal section, we can see here, this is the parotid gland. This is the parotid duct running superficial to the masseter muscle. Now at its anterior border, that is at the anterior border of the masseter muscle, the duct is going to turn medially and it is going to pierce certain structures. So which are those structures which are pierced by the parotid duct? They are, the most superficial structure will be the buccal pad of fat which is present in the cheek, and then there is a fascia covering a muscle. The muscle is the buccinator muscle and the fascia is buccopharyngeal fascia. This is the fascia which will be also continuous with the fascia on the superior constrictor of the pharynx muscle. So that's why the name is buccopharyngeal fascia. And then after that, after piercing the buccinator muscle, it is going to run a course in the submucosa and then pierces the mucosa of the cheek. So what are the structures that are pierced by the parotid duct? They are, first is buccal pad of fat, second is buccopharyngeal fascia, third is buccinator muscle, and fourth is the mucosa of the cheek. Now where does it open? After piercing the mucosa? After piercing the mucosa, it opens into the vestibule of the mouth. Vestibule of the mouth is that part of the oral cavity which is present between the cheeks on the lateral aspect and the gum and the teeth on the medial aspect. So here it opens into the vestibule of the mouth opposite to the crown of upper second molar tooth. So this is the opening, that is in the vestibule of mouth opposite to the crown of upper second molar tooth. Now let us look at the surface marking of parotid gland. How do you show that? What we do is we take 2 points. First point is here between the nasal ala of nose and the upper red margin of the upper lip. Right, so midway between these two, ala of nose and the upper margin of the upper lip, midway between that we take the first point, and second point is at the lower border of the tragus of external ear. We draw an imaginary line connecting these 2 points, and then the middle third of this imaginary line that corresponds to the parotid duct. So this is about the course of the parotid duct, structures pierced by parotid duct, and the surface marking of the parotid duct. So that's all for this video. Thanks for watching, and if you have not subscribed, please subscribe my channel so that I can put more such videos. And if you want the questions and answers in anatomy, all types of that, then visit the website, that is anatomyqa.com. Thanks once again.